Pentecost spirit and setting the mood right. Please, let's put the cooking of the Nigerians aside for just a bit, okay? And so we'll put that aside, and we are stepping into the BFS clinic where we are talking sexual and reproductive health. It is a field of research, healthcare, and social activism that explores the health of an individual's reproductive system and sexual well-being during all stages of their life. So the International Planned Parenthood Federation, IPPF, is a leading sexual and reproductive health and rights advocacy voice in the world that works with governments, the African Union, regional economic commissions, the Pan-African Parliament, and the United Nations bodies, among others, to expand political and financial commitments to sexual and reproductive health and rights in Africa. Joining me in studio is Abna Edubia Amoa. She is the director of PPAG, and she's going to be giving us where we are and all the feel about PPAG. And also sat here is Dr. Alvaro Bermejo, who is on a visit to Ghana. He is the Director General of the International Planned Parenthood Federation. Good morning, ladies and gentlemen. Good morning. How are you?
I'm well, thank you.
How was your weekend? Were you cooking Nigeria?
Well, a little
we were celebrating, yes. I have to confess, yes. I've just come from Ivory Coast and had the pleasure of being at the stadium there for the semi-finals.
Oh,
so
wow.
I really wanted to support
Awesome.
them.
What was the feeling like in stadium?
It was crazy.
Oh, wow, awesome stuff. And so you're also cooking Nigeria. Oh, come on. Okay, let's put that aside. Let's talk reproductive health. I'll begin with you, Abna. First, tell us where we are in terms of reproductive health in Ghana. Good morning again.
Good morning, and good morning to your viewers. I bring you greetings from PPAG, from the council, the volunteers and staff of PPAG. We're quite excited to be here, and especially on the occasion of the visit of the Director General. Yes, we are in a very happy mood. Yeah, so when it comes to reproductive health issues in Ghana, I think we've come a long way, but we still have a very long way to go. Okay. You know, as PPAG, we've been working since 1967 on issues of reproductive health and rights. So when we started off with family planning, a group of volunteers, mainly doctors at the Kolebu Teaching Hospital, saw the need, you know, to look at the well-being of families, of couples, in terms of reproduction, childbearing. And so whether you have to have children too soon, too quickly, you know, the intervals, and then probably also too late, you know, and how it affects the health of couples, especially women. And so they started talking about family planning, and that's how with the support of the international community, including IPPF, PPAG was born. So in fact, it started off at the Kolebu Teaching Hospital, and it's and we've been working on ensuring that couples, from the beginning, it was couples having access to family planning, and so started also with ensuring that within the community, people understood what family planning was, working with government to institute policies, population policies that would ensure the good health and well-being of couples. But then at the turn of the millennium, let me put it, getting to the end of the 1990s, 98, 99. Yes, getting to the beginning of 2000. The focus changed a little bit, and it's also because of the happenings within the international community. The ICPD had happened in 1994, and reproductive health of family planning has actually been expanded. Reproductive health had expanded to involve a lot of other issues, you know, including abortion issues and how it affects the health of women, including HIV, you know, at that time, STIs, the cancers and others. And so there was an expanded program which, you know, had effect on the programming of PPAG in Ghana. And then also looking at the youth badge that we were having and being able to reap the demographic dividend, there was a need to focus on young people's health as well. And so it was expanded from just couples to young people and young individuals so that we can safeguard their health and ensure their well-being as well. So since 2000, for PPAG, we've been focusing on young people and women and other vulnerable groups, ensuring that they have access to the bouquet of sexual and reproductive health and rights, services and education as well. We work across Ghana from 10 facilities, and 6 of the 10 facilities have youth centers where young people have safe spaces that they can meet and learn about their reproductive health.
How's that going in terms of success? How's that going with the young people? What are some of the measures you've employed, and how has it worked in your favor or not?
So for young people, it's nothing for us without us. So
Nothing
we work
for us without us.
So we work very closely with young people, ensuring that one, they have the information, the knowledge is very, very important, and that the knowledge translates also to the uptake of services. The behavioral change is also quite important as well. And then we work with communities as well, because we understand that we have community structures that inhibit the access of reproductive health and services and information for young people as well. So we work with community leaders, traditional leaders, religious authorities, families, parents, to ensure that young people have the support that is needed to be able to first educate themselves and put whatever they have learned into practice, but also, reach out to other young people as well. So they lead the advocacy at the community level as well. But nationally also, we've been working with the Ministry of Health and Ghana Health Service also in many other intervention areas, which is family planning, ensuring that we have commodity security, we have access to family planning methods, the method mix is available so that people or young people or women who want to have access to family planning methods, they have the bouquet of choices that they can make as well. So
great stuff from your team. Okay, Dr. Alvaro, tell us about the IPPF, its vision, and how that is being achieved globally.
Well, we were created in 1952, so we've been around for over 70 years now. Very much a federation of organizations like PPAG in 142 countries. Whoa. So really the largest organization in the world working on sexual and reproductive rights, the most intimate of rights, really. When women can take control of their bodies, they take control of their future and of their life. So really helping make that happen. And as you said at the beginning, Val, and thanks for that introduction, we help provide services. So around the world, we have over 40,000 clinics and distribution points around the world, like the 10 that Abina just mentioned here, 40,000 around the world, really providing over 200 million services a year. So a very large organization that uses the experience from those providers, from that interaction with women and young people around the world, to also advocate to governments and to change laws and create a policy environment that is more conducive to you being able to make those decisions with all the information that you need and with the commodities that you need.
Okay, which are some of the countries under the IPPF?
Well, apart
from Ghana,
it's really all countries. It's not about south or north. So we're very big in the US, in Europe, in Canada, and we're also very big in the tiny islands of the Pacific or the Caribbean and everything in between. So I've come here really looking at what is happening in West Africa, where indicators are showing that we're making progress. I went to Benin first, Cote d'Ivoire, where I got to be at the semi-final, and then towards the final here, but more importantly, to see the work, the fantastic work of PPAG.
Awesome stuff. Okay, so Abna, how have your relationship, how has it been over the past years working with IPPF?
It's been phenomenal, I must say, providing everything, including resources, technical support, capacity building, and everything. And it's more like when you know that there is someone that is behind you and that can provide you with the support that you need to be able to accomplish the dreams that you have. So it's more like, Alvaro doesn't want me to say, but the big brother that provides you with the confidence, you know, that you need to be able to move on. And you understand, you know that they understand your issues and they allow you to work within your own context. And so there's nothing like, you know, importing ideas from anywhere into Ghana. It's more around what is your social context and what works well for you. What are your issues and how can we support you to be able to do your work? And so it's been really good.
Okay, I saw you're excited. Your big brother is in town. Yes, you planned a host of activities to excite your big brother. Can you share some of these activities with us? What's lined up for Alvaro?
Sure. So over the weekend, we did some activities. We have a big program in Cape Coast. So we were there yesterday to look at the Cape Coast Clinic, the PPAG clinic in Cape Coast. We are putting up a specialist hospital, maternity hospital, beside the Cape Coast Clinic, where we will be able to provide specialized services in reproductive health to those who need it in the central region. And so we were there to look at the progress that has been made. And we'll continue today.
Okay, wait, before you tell us the rest of the activities, I want to ask, what was your experience like in Cape Coast, visiting the hospital, the indigents, the whole experience? What was it like, Alvaro?
It was really amazing, I would say. First, I had never been outside of Accra here in Ghana, so it was my first getting to see something else. And, you know, what was most exciting was to see, on the one hand, how entrepreneur PPAG has become. It wasn't always like this. Now, thanks to Abina, to the president, and to a number of other people, there's a lot of how do we keep improving? How do we not just rest on our laurels? How do we maintain ourselves relevant in the changing context? And you can see that in the building of this new clinic, but also to see how much the local community in Cape Coast is involved in designing the clinic. So everybody was there, you know, everybody was part of the planning group or this group or that group. And then in the afternoon we met with a lot of the young people that she was mentioning and really get to understand the reality of teenage pregnancy, for example, in that region where the levels are high, and how young people are working with peers to try and lower that, to make sure that women decide when they want to have children, if they want to have children, and how spaced they are. So that was a real privilege, I have to say.
Okay, and so the activities continue today. Okay, do you want to tell us more?
Sure. So so today we are going to the Ministry of Health to meet with the Ministry of Health, because we work in health.
Yes,
and we've been collaborating with the Ministry of Health. You know, in fact, with PPAG we partner governments, and our mission is to complement the efforts of government to ensure the well-being of Ghanaians. And so we work very closely with the Ministry of Health. So we'll be at the Ministry of Health to discuss the programs that we have and how we can strengthen the partnership moving forward. And then also we'll be at the UNFPA as well to also look at similar things. In the evening, there will be a partners meeting because it's a very packed day, and we know Accra is quite, you know, so we want to bring everyone together to show them our big brother and to discuss and to discuss issues of mutual, you know, the issues that bring us together, to see how we can strengthen our partnership and move the agenda of reproductive health forward in Ghana. So that's how it looks like.
Right, Alvaro. So, what are the key objectives and the focus, especially of your visits to Ghana? Maybe you have them tabled. Like to share?
So, look, we've been supporting PPAG since it was created. Since day one, we have been every year providing support, seeing what we can do. But PPAG is changing. PPAG is becoming, as I was saying, more entrepreneur, looking to expand its services, to up the quality of its services, and to become more sustainable. So we want to see how we adjust and increase our support to help them in that transition. So that's why the visit to the new clinic, which will become a flagship for PPAG across the country, a model that other regions might follow. So I was really wanting to judge, how do we do this best? Will they succeed? In a way, you want to get a sense of, is there the energy to succeed in here? And I really feel there is. I really feel there is. So we will see how we can better support that. That was the main thing. I also wanted to say thank you to the authorities, to the partners of PPAG for the work that we've done together with them.
Right. Abna, how would you want the world to see health and rights?
I think that everyone has rights.
Okay.
And I want the world to acknowledge the fact that everyone has rights, and the fact that everyone must be allowed to enjoy their rights. And before people can enjoy their rights, they must have the information. Okay, so access to information is very important. The structures that must be put in place, which includes the curriculum or the bouquet of the content of the information, is something that is very important, you know. And so everyone must have the full information and be able to decide for themselves, especially young people. Because I think in our part of the world, especially in Ghana, we tend to think that issues of reproductive health is something that people get to know automatically, which is not the case. You know, everything must be learned. And so I think we, as a country, we must open up and make investments in the right places so that young people and everyone would have access to reproductive health information to inform their choices, you know, of what to do and what not to do, to ensure their well-being, and to also improve their health-seeking behavior. You know, because when you have access to the information, you know when something is wrong, and then you know where to go, and then you seek help in that regard.
Right. So what's been the biggest challenge that the PPAG has faced or is facing, and how have you overcome it, or measures put in place to overcome it?
Our biggest challenge has been the stigmatization of issues of reproductive health and rights. And the fact that when people hear of reproductive health, they think that you are the one actually that is promoting promiscuity. And not the other way around, you know. And so people see reproductive health as an issue that must not be discussed in public.
Wait, for instance, when officials from the PPAG go out to educate and inform people, they face stigmatization?
Yes. So the officers face stigmatization. The people that they are educating also face stigmatization as well. And then also sometimes even in official circles, you know, when you bring up issues of reproductive health, they talk about, well, people can't find food, so why are you talking about reproductive health? But what we forget is that if someone doesn't have a sound health, you know, food might be available, but they might not be able to enjoy the food, you know. And so reproductive health is central to the health of every individual, especially women. You know, because as I always say, we are sexual beings. You know, whichever way you look at it, everyone has a role to play when it comes to reproductive health, and we must all ensure that we are doing our part. Whether you are a public official, you know, who has to set the policies and ensure that there are systems in place, you know, to move the agenda forward. Whether you are a healthcare professional who has to ensure that, you know, you provide quality and responsive services to everyone, including young people, including people living with disabilities and everything. And whether you're a parent, you know, who has to ensure that young people also receive the information that they need to have at the right age, you know, the correct type of information to be able to make the right choices. And even the educational authorities, you know, because once they are adolescent, they are in school and they spend a lot of time in school. So what kind of systems are we putting in place in the schools to ensure that young people have access to reproductive health information and even services? Our infirmary nurses, how well, you know, are they trained to take care of the issues of reproductive issues, as far as these young people and young girls are concerned in the infirmaries, in our schools. And so all these, systems must be structured, put in place, aligned, linked to each other to ensure that everyone has access to reproductive health information and services.
You're a volunteer-based organization. How's volunteerism doing? How's it doing now?
It's doing quite
we have
well.
lots of volunteers, willing volunteers.
Yes, we still have willing volunteers.
Okay.
Except that the motivation has gone down a little bit, but then there's still a lot of volunteers out there who are willing and are there to support our work. But we still call for more volunteers.
How does one become a volunteer?
Please go to the PPAG website.
Okay, what's the PPAG website?
www.ppag-gh.org.
ppag-gh.org.
Yes.
And you find steps on how to become a volunteer.
Yes.
It's been amazing chatting with you, Abna.
Thank you very much.
Alvaro, final words before we leave the studio.
I would really want to leave with words of encouragement. I think we're working in the right direction. As Abina has said, this is really about ensuring access, ensuring rights for everyone, with the exclusion of nobody. We were meeting yesterday with young people with disabilities, young people that are excluded for other reasons for their communities. And we have to really, when we say to all, everyone, it has to be to everyone. We can't exclude because you don't walk like me, because you don't see like me, because you don't hear like me. No, it really is everybody. And I think there are changes that are happening in that direction that are very positive. But we also face this resistance, this stigma that we were talking about. And a lot of the young people were just saying, I just wish I would be allowed to speak about this, that we could speak about this openly in different places. We're all sexual beings. We're all here on this world because somebody has had sex and wanted to, hopefully wanted to have children. So let's talk about it. Let's discuss how we do this with pleasure, more responsibly, and with less risk. That's what we're all here to achieve. And as I always say, what's good for the girl, what's good for the woman is also good for the family and for the country, for the economy. We know that. We've seen it in so many countries. So let's just do it.
Thank you, Dr. Alvaro. Dr. Alvaro Bermejo is the Director General of the International Planned Parenthood Federation, IPPF, and is on a visit to Ghana. Also sat at the table is Abna Dubiamwa, and she is Executive Director of PPAG, and we've been having a discussion on sexual and reproductive health. And if you want more on this conversation, the whole conversation is on our Facebook at GTV Ghana. You can catch the whole thing again and put your notes down. Also across social media, we are GTV Ghana, and WhatsApp is 055-5561034. So exciting news from the Medi Moses family, and they are introducing the all-new Medi Moses garlic capsules full of garlic and cinnamon, and improves blood circulation, eases muscle stiffness, detoxifies the body, and boosts immunity and more. Available in pharmacies and herbal shops everywhere. Guys, the show is active. We are not rushing out of the studio. We'll be back shortly. Jay and I will be on the social media corner where everybody's cooking Nigeria. There's also headlines with CAF and Alan, the newspaper review, the sports. We'll also have an interesting conversation with the Keepers. There's a music group later on the lighter side of the breakfast table. We'll see you after this break.